name's Kieran Richards. We're doing the anterior drawer test on the knee. We'll sit on the foot to keep the leg immobile. And then we'll pull anteriorly to check for laxity in the ACL. If there's a lot of laxity compared to the other knee, then it's likely a positive test. So we'll do that bilaterally to check for laxity. Doing the posterior drawer sign test. We'll sit on the foot to keep it immobile, and then push posteriorly to see if there's any laxity in the PCL. And we'll do that bilaterally to see if there's a difference. If there's more laxity in one or the other, then it could be a possible PCL tear.
Alright, my name is Reed Newey, and I'm going to be doing the anterior Lockman's test. So for this, we'll have the athlete extend their leg. We're going to create a shearing force here. So we're going to be testing for possible ACL injury. So we're going to push down here on the femur and pull the back of the tibia here, creating that shearing force. We're looking for any laxity with positive test, and we'll test bilaterally to see how it compares to the other knee. Now we're going to do the posterior Lockman's test. So for this one, we're testing for a PCL injury. So we'll push down on the tibia and pull up on the femur here, creating that shearing force. And again, we're testing for a laxity for the positive test, and we can compare bilaterally to see how it is in the other knee.
Okay, my name is Mitchell Bunn, and we're doing the lever sign test to check for an ACL tear. So what you're going to do is going to have the patient relaxed, put your fist underneath the belly of the gastroc there, and you're going to push down right above the patella, and the foot should move. If it doesn't move, that's a positive sign for an ACL tear. So we're good.
I'm Shane Yoho. I'm doing the valgus test on the knee. This would be testing for an injury to the MCL. So you would bring the leg up like this, relax your leg a little bit, and you're going to be pushing this way on the shank and this way on the femur to test the laxity in the MCL. If there's laxity, then that would be a positive sign for an MCL tear. You would do this bilaterally. Good. Okay, now this next test is the varus test, and this is testing for laxity or a sprain in the LCL. So this one, you can bring their leg over to the side of the table, and you would be pushing here on the shank to be testing for laxity in the LCL.
Doing the Appen's compression test, what we'll do is we'll have the patient relax and just put their knee at 90 degrees flexed, and we'll compress the joint by pushing down, and then internally and externally rotating the leg. And if there's pain over the meniscus, it could be a possible problem with meniscus, and that would be a positive test.
Alright, next we'll be doing the McMurray's test. So we're going to put our thumb and finger here over the joint line, and we're going to grab the heel here. We can internally rotate the foot and apply a varus force. We're going to move it in and out, flexion and extension here, and we're looking for a painful click as a sign of a possible meniscus injury. We can also externally rotate the foot and apply valgus force and do the same thing, flexion and extension, and then feel for a painful click.
Alright, next we have the Thessalys test. So you're going to have your patient stand on one foot, and they're going to squat a little and rotate on their knee. And this, you'll be looking for pain in the meniscus. If there's pain, then that would be a positive test.
Okay, next we're doing the patellar apprehension test. So what we're going to do is we're going to just push gently on the patella. We're going to push it laterally. And this is testing for a sublux patella. So if I begin to push and they are pretty apprehensive about it, they start muscle guarding and things of that sort, then that's going to be a positive sign that their patella was subluxed. All right, next we're doing the patellar compression test. We're going to have the athlete in this position, and they're just going to contract their quads. We can actually have them contract their quads on their own. If that's painful, then it would be probably a positive sign. But now we're going to compress just above the patella and have them contract their quads, and maybe do that again with a little more pressure. If there is pain, that's a positive sign of patellar femoral syndrome or chondromalacia in the knee joint.
All right, we're doing the noble compression test. We'll be looking for pain we're checking for ITBS, iliotibial band syndrome, also known as runner's knee. So we'll compress just above the lateral condyle of the femur. And we'll just go through the range of motion. And if there's pain through it, then that would be indicative of a positive test. If not, then no.